Good morning, Firoza. It is a pleasure to connect with you. And let me congratulate you for being the Woman Entrepreneur of the Year. So we had the privilege to acknowledge 3D Graphy Medical Awards, Woman Entrepreneur of the Year, to Firoza. Work that you've been doing in 3D printing, and we've seen that you have time. It's been 7 years we've been seeing your growth story. Let me ask Firoza about your uh, response from this particular technology in terms of how 3D printing in the medical space India going forward.
Hmm. Absolutely. Thank you so much, Dr. Shibu, as well as your entire team at 3D Graphy Medical. And as you mentioned, we've been in touch for a very long time. So we've actually seen each other grow in that particular way. And I think, started off the medical journey in 2014, somewhere around then. And we started off seeing the technology as something that could benefit as advanced diagnostics, and not just something which is a fancy 3D print of the model of the patient's anatomy, but something that actually adds value to the patient's life. Whether you do a surgery, should you not go for a surgery? In that, if you do go ahead to go for a surgery, then what are the kinds of plans that you should choose? What's the best possible outcome that the surgeon can give to their patient over there? So it started off with maybe being a trend which was happening globally, but India had not adopted. But over a period of time, we've seen that change into giving actual benefit to the patients and to their lives and to their families' lives as well. So in the last 5 years, we've actually seen the entire industry grow from just doing individual cases through surgeons who are genuinely deeply interested into getting new technologies into the country, to seeing actual adoption by hospitals, by clinics, by radiology, medical diagnostic radiology departments, wherein we see in-house adoption of 3D printing and the technologies with the softwares along with it. So that being said, with so much growth happening across the industry, it's imperative that we have people as well who come on board, who are well educated, who are well trained and interested into doing the designing and the printing of these kinds of models. So there's a huge requirement for human resource also coming up. And being in the biomedical background per se, the people that who would be best fitted for roles like these would be in the biomedical background, biotech background. That being said, I've seen a lot of people in mechanical engineering also showing interest in the healthcare activities. And for the same reason, we had launched a course as well, which teaches anatomical segmentation to a particular level. So this was done in order to raise the awareness in the students' community, but also to get them trained on the necessary skills that they would require once they want to go into the field and go real life out there. So I definitely see a huge growth in terms of adoption of the technology from the user side, as well as adoption of the technology from the student side who want to go ahead and grow out the technology. And there are loads of people out there as well working on different aspects of medical 3D printing. Everyone coming in together, growing the industry, and taking India to a new level where probably we'll be able to get more global contracts as well, and globalize the entire technology from India itself. So look at India becoming the design powerhouse or the intellectual powerhouse, and have localized 3D printing also across the world. So this is the way in which I believe that the technology is headed, and let's hope, fingers crossed, that day comes soon enough where we see this future going into reality.
Sure, Firoz. I think we have set a pathway going forward. And what I also see is the Prime Minister's initiative on Atmanirbhar Bharat. I think
Yes.
we've got a lot of expected, potential there, with entrepreneurs who have come forward and they're actually looking at taking this stage or ensure that how it can actually. And also with digital, I think 3D printing, same goal and purpose. With the intention, the 3D imaging, everything is digital. now is the time when global, companies abroad, they are looking at medical solutions. They can probably send a file, and it's just a matter to uh, look at all the aspects, standardization when it comes to materials,
Yeah.
what, but that is a course, and that is something that needs to be done, and that has been done already. I'm sure all the organizations are looking into it, but it's just a matter of a button to create the anatomical models. Maybe it could be to serve the community fully in terms of offering those solutions. And India has the potential in the next big 3D print service hub.
Yeah.
And I'm sure government is also supportive enough through various initiatives, and also to then support jobs, because jobs are going to be the key. And I'm in these pandemic times, we've all been facing hardships, especially for companies who have, had a lot of overhead.
Yeah.
But it's just a matter of time. But if you use technology in the right frame of mind, in terms of the right way and the construct, I think there's a. And we wish you all the best for all the good work that you're doing, Firoza. Let me understand from you as a medical professional. When I'm saying as a biomedical engineer, you did mention about the as an organization, how challenging to Firoza in terms of stepping up the company it is today.
So, I'm a biotech engineer actually. I passed out in 2014 and I had realized that I was doing a lot of lab work, wherein I was doing tissue engineering. I was working with antibodies and stuff. And I had realized over a period of time that, yes, this is something that is very, very exciting. But maybe I might want to look at something which is more innovative on a day-to-day basis. Maybe that's just the kind of person that I was when I was a youngster. So I decided to move out of lab role, and I did do a couple of months of another job. But that's when this opportunity was placed to me from Sahas Softech, wherein my brothers Saurabh and Sagar, and they just said that since they were doing a lot of work in engineering, in automotive, in jewelry, and all of those areas, they said that you have a biotech background wherein you have an anatomy based background, and see whether this is something that you would like to grow, or this is something that you'd like to explore. So I was anyway out of that particular industry and I wanted to try out something new. So that's how I got on board. And when I started reading up about everything that is happening online, across the world, we realized that none of those things, about 90% of those things, have not happened in India. So then we started looking at why is this particular situation there in a country like ours, where technology is adopted quite decently along with global countries. Even though scaling up takes time, adoption is not that slow. So we started getting in touch with doctors. That's when our first case in India of pediatric cardiology, the first in soft tissue across India, took place. And to be very honest, at that time, I did not know the software. Neither my teammates knew about the software, but we had very good, a hand on the technology of 3D printing per se. So what we had to focus on was getting the designing right, because if that's not right, the 3D printer is not going to get the print right for you. So spent about 10 to 12 odd days, day in, day out, not sleeping well, learned the software and learned how to read the CT and MRI scans. Of course, the radiology aspect was done with the help of the doctors who were involved in the case as well. But learned how to do that and gave them the model which was accurate, and the patient was actually supposed to be rejected for surgery, but based on the model the doctors realized that they can actually go in for surgery, and not just any mid-level surgery, but the highest level which would give the patient the highest kind of a good quality of life going forward. So that gave us the boost basically, and going forward we started exploring more and more specializations. We saw that a lot of work in soft tissue is not being done, so we went into hepatology, urology, neurosurgery and expanded those areas. Eventually, moving out of just providing anatomical models, we realized that there is a necessity for product innovation as well, wherein there is customization in that aspect. So we started making custom drilling guides, cutting guides for different types of osteotomies. And then going forward, going one step further, we were very scared of going into titanium implants earlier. But then we put in we took a next step towards going into customized implants as well. And then with our collaboration with 3D Incredible, that became an even better platform for us to explore that particular aspect. So we've taken steps very slowly over the last 6 years, and it's been a very good journey but each step that we took, we explored it completely, decided what we can do, what we cannot do, understood the positives and negatives of 3D printing. I wouldn't say negatives, let me rephrase it to limitations of 3D printing, understanding both of these areas and then choosing a path forward. So that's been a journey of the last 6 years, which I'm telling you in short, but it's something which has been it's been a roller coaster. Sometimes it has been great, sometimes it has been very discouraging. But at the end of the day, the satisfaction that you feel in this field is not something that I believe I could have personally found anywhere else. So for my journey, yes, it's been a wonderful path so far.
No,
Yeah.
Firoza, I also really appreciate know that it's been a commendable journey for you. More than this aspect to begin with, it is the passion which any business. I think if the gestation is over with 3 years and you've achieved it, and I'm sure as an entrepreneur, we are very happy to know that you've been doing it and much expected of you. And I'm sure the which connected with the doctors and surgeons are also looking at solutions, because 3D graphic is a platform we started last year. 3D printing world is the larger platform that started communicating on aerospace and medical at large, and jewelry and all the other sectors, architecture and construction. Where we started in the year 2004. Journeys go together.
Yes, exactly.
3D Graphy was last year when I had the privilege of Shri Subhash Desai, who is the industry minister, who came and inaugurated this platform. The clear intention was to create a consortium, Firoza, where the doctors, surgeons from various different specializations come and understand the principles of 3D printing technology, and also and subsequently with time, workshops, to show some good work that been done in the space. That they were so app is very, very key and important that we thought. And I think 3D Graphy as a platform is really shaping up with experts like you also knowledge for the good work with 3D Graphy, medical efforts that we that also helps us to connect and know who the who the service providers. So both we've been able to connect, and things like this would be also good conference together.
I'm sorry, I lost you in the last thing.
I'm saying, Firoza, do you think platform would be eventually good for us forward in printing per se?
Oh, absolutely. I mean, if this pandemic has taught us anything, that it is that we can survive no matter how, and we can get business running. We don't need to physically be there, go meet clients, go meet prospective partners. It can all be done in a virtual format as well. And platforms like yours, I mean, we've been connected for what now, last 6-7 years, and we've seen that even initially it used to get everyone together physically, where people could speak one-on-one and they could get the work going. And it also gives that needed recognition to people, to give them a space to showcase their talents, to showcase their work, the good work that they've been doing in their own areas. And now we are doing the same thing virtually. So the spirit of the platform does not ever go away. It is just moving from a physical to the virtual platform. And I'm sure I've been following all of your work even earlier. And I know that it's brought a lot of people to write and to light and their good work to light as well. So it's these platforms cannot ever go away. It's something that we need as an industry as well, to connect with other people in the industry, because you go and you find those people and you get them on the platform, which as industry people we probably would not have been able to do. So thank you so much for bringing everyone together a couple of times a year, and even continuously through your efforts of being in touch with everyone. And it really is an honor to be a part of the platform as well, and also connect with all the other people who are doing good work in the industry. So thank you so much.
Thank you so much, Firoza. It is this radiography medical awards definitely deserve this acknowledgement, and all the best
Thank
for your endeavor, and we wish you all the best in your career. And I'm sure we'll be in
thank you
touch
so much. Wish you.
in the process. And we
Definitely, definitely.
thank you so much.
Yes, thank you so much, Dr. Shiv.